Hi, I'm Nancy Lindell, Public Relations for Mission Health, and I'm here today with Dr. William Hathaway for our COVID-19 update. Before we get started, I'd like to remind you that if you are uninsured at this time and need some help navigating getting reinsured, there's a toll-free number on your screen. And we also like to continue to mention that we are here at Mission Hospital using plasma therapy on our COVID-19 patients who need it. And if you are a COVID-19 or you're recovered from COVID-19, you can go to the Blood Connection or the Red Cross and make a donation, and that sure would be appreciated. So, Dr. Hathaway, where are we this week? What's trending with our numbers?
It's really interesting as I look at the trends since really the end of July, the beginning of August. We've seen a downward trend in terms of the number of hospitalizations, both at Mission and across our health system and at the state level. We were typically in the 1,000 to 1,100 number for patients hospitalized across the state about almost 2 months ago, a month and a half ago. And that number has tapered down into the 800 to 900 range, so a significant drop overall. And at Mission, we peaked at 45 to 50 in our health system, and we're now down in the 20 to 30 range. So overall, a continued decline in the number of cases, which has been good, that have been hospitalized. Interestingly, and I think most people are aware of this, we did see a slight rise in the number of cases across the state as we opened the school year, and particularly at the collegiate level, but that wasn't accompanied by an increase in the total number of hospitalizations, and we're really grateful for that.
Yeah, I think it's interesting to note when you're looking at reports about increased cases and that sort of thing, the difference between what it means to have COVID-19 and what it means to be hospitalized with it. So there's a big difference in the number of people who are really sick enough to end up in the hospital.
Yeah, that's exactly right. And I think what we've learned over the almost 7 months, I guess it's 9 months plus if you go back to when the virus was first described in China at the end of December of 2019. And we saw our first cases in the United States at the end of January and then locally here in March. If you go back and look to see how the illness has changed over time, it's been fascinating, and we're still trying to figure out what all those reasons are. We saw a tremendous number of cases early on, particularly in the Northeast, as you remember, in New Jersey and New York, and they were accompanied by high rates of hospitalization and high rates of mortality at that time. Since then, while the cases have continued to rise and fall in different areas of the country at different rates, we've seen somewhat of an interesting phenomenon in that where there have been some recent increases in cases, we haven't seen an elevation in the number of hospitalizations more recently. Not exactly sure what the explanation for that is. We think part of it is it's infecting healthier people, but there's also a theory that our use of masks has actually contributed to people getting less severe infections if they're infected. The theory behind that is that the amount of viral load that we get, the number of particles that we inhale and get into our respiratory tracts, may actually be lesser. And if that viral load is less, then we have a less severe infection. And so that just argues again the critical importance of using a mask. Even if imperfect, they can lead to perhaps less symptomatic infection, less severe infection, or even in some cases, frankly, asymptomatic infection.
There is so much that's been learned over the past 7, 8, 9 months regarding this that we did not know at the beginning, and we'll continue to learn. And one of those things, of course, is the development of a vaccine. I know a lot of people are anxious about that. I know a lot of people are concerned about it, safety and that sort of thing. What can you tell us about these vaccine trials?
Well, they're ongoing. And we're grateful for that. I think most people are aware that the government put a huge amount of resources behind this through multiple different departments and organizations within the government itself, and put that under the guise of what we call Operation Warp Speed for the Star Trek fans and other sci-fi fans. And the purpose behind that was they needed to rapidly develop a vaccine to create the immunity that we need to get back to normal. As part of that Operation Warp Speed, the government has invested, there's 4 different major categories of vaccine that are being developed based on the technology. And the government has picked 2 leading candidates in each of those 4 categories to develop. They're instead of putting all of their eggs into one basket, one vaccine, they decided to have a, let's say, a diversified portfolio, if you will, and then see which one will come and provide the best benefits. And then they're pooling the data so that they can have comparisons across the different vaccine trials. Right now we have 9 different trials that are currently undergoing across the globe, which are phase 3 trials. Those are large-scale trials involving tens of thousands of patients designed to investigate safety and efficacy. And it's at the conclusion of these phase 3 trials when we'll know if we have a vaccine that's actually safe and able to be administered into patients. I think most people are aware that we've heard in the last day or two that one of these vaccine trials was put temporarily on hold. That was the AstraZeneca trial that's looking at what we call a viral vector vaccine. They're actually taking a virus that's not the coronavirus, and they're injecting coronavirus DNA material into it and then infecting people with that and allowing immunity to develop there. Infection doesn't happen, but immunity happens. A very creative technique. It's been used in investigating Ebola vaccinations as an example. That trial was temporarily put on hold when they had what we call a serious adverse event. And this serious adverse event means that someone in the trial had a problem. This specific problem related to something that they think might be, they haven't made a diagnosis for sure, might be something called transverse myelitis, which was a neurologic disease related to the spine. Right now, many people initially said, oh, that's scary, that means the vaccine might be a problem. And I would contend, and others would contend, that this is exactly what should happen in the conduct of one of these trials, is that the independent Data Safety and Monitoring Board that is charged with evaluating the safety of the trial said, oops, something happened, let's take a pause, let's look, let's see, did the vaccine candidate cause this problem? Did the patient have the problem just coincidentally, independent of having gotten the shot? What is the relationship between the two? And before we move forward in a widespread fashion, we want to make sure we know what's happening. It's really critical that people understand that this is why vaccine trials take time, because people get sick when they're in trials, and it may or may not be related to the vaccine itself. And so rather than shelf the whole potential for a life-saving treatment because someone got sick who happened to be in the trial, we need to make sure that they're related or they're not related. And that's why these data safety monitoring boards and the conduct of these clinical trials is so important, and why, frankly, it's just going to take time, why we don't want to rush this.
Exactly. And I think, too, with what you're talking about, there are different people who are invited to be in these trials as they spread out to more people. So you're looking at people our age, you're looking at younger people, older people. Are we also incorporating people who may have some kind of comorbidity situation, something like that?
Yeah, it's critically important that when you design a clinical trial that the enrollment in the trial is reflective of the people to whom you're going to give the vaccination. For example, if we studied a vaccine in 20 to 40-year-old healthy white Americans, and we found it to be very safe and efficacious, and then we administered it globally to people of all colors, people of all ages, people with all illnesses, we couldn't generalize those results to the broader population. And so in order to ensure both safety and efficacy of the vaccine, we have to recruit a diverse group of people, including people who are at high risk with comorbidities, comorbidities, of course, is the fancy term for other illnesses, heart failure, lung disease, diabetes, obesity, etc. And so it'll be important that as these trials go on, and they're very conscientious and thoughtful about this as they do the trial design, that people enrolled in the trials represent the people who are actually going to get the vaccine.
So with this trial and the vaccine still some months away probably, or maybe next year, early next year at some point, and as we approach winter, flu season, et cetera, we're still, and frankly, the being indoors, I mean, you know, I think for most people having this out there, it's been a little bit easier with the weather to get outside and at least feel a little bit of freedom to do things and travel. But we're heading into months for the northern states where people are going to be fairly shut in.
Yeah, and that gives us concern. We know that any infectious disease is more readily transmitted the closer interpersonal relationships are and contacts between people are. And of course, in colder weather, we're not outside, we're more densely packed together. And we have to be hyper-conscious of two things. Number one, attempting to maintain the social distancing, and that means physical distancing and of course the masks. It's critical that we use the mask even more as we come into the flu season. And then the second thing, is, as you alluded to slightly there, was that as flu season comes, we want to make sure that people get their flu vaccinations too. We know that anyone over the age of 6 months, barring any absolute medical contraindication to getting a vaccine, and there's very, very few, should get a flu vaccine. We don't want people either to get the illness at the same time or to get it sequentially, because the effects of that could be absolutely devastating. And I'm going to be honest, we know that the flu vaccine is not perfect, but we do know that getting it, if it doesn't completely prevent the illness, even getting the vaccine can lessen the severity of the illness when people get it. So it's really important now more than ever that people get the vaccine that we have available.
With the governor's announcement last week of us being at 2.5, are there any effects for the hospital as far as visitation or anything? I know that we've opened the Eckerd Living Center, which is our assisted living in Highlands, for a little bit more visitation, which has been really nice for those families. But we also need to err on the side of caution, of course, still. How does anything of the governor's announcement affect us here at the hospital?
Well, before I comment on that, I'd like to say that I was personally, from the medical point of view, very pleased with the fact that we didn't go from, the restrictions that were previously in place to a wide open economy. We saw that happen in Texas and in Florida, and we saw huge numbers of cases in July, after they opened in June. In both those states, and that can happen here and will happen here if we're not cautious. And so the stepwise progression, the evidence-based pathway that Secretary Cohen and Governor Cooper and their staffs have advocated for is really, it's as hard as it is in many, many ways, and we all acknowledge the difficulties, it will get us where we need to be faster than if we rush to that endpoint. We must be there's an old phrase that you have to run slow or walk slow to move fast. And that's really the case in this circumstance. If we don't do this cautiously, it'll be a problem. And so the fact that we opened the gyms was good, but the fact that we opened them only with limited capacity was even better. It's hard on all the gyms, I understand that, but that's an important thing. We increased the social gatherings to 25 indoors and 50 outdoors from their previous restrictions. That's good. It's still not wide open, but it's better than opening wide up. With respect to the hospital and our skilled nursing facilities, we are not planning to change our visiting policy at this point in time. We recognize the challenges that visiting restrictions imposes on everybody, but we think we've struck that balance, that critical balance between meeting the patient's needs by having visitors in a controlled circumstance versus having a wide open assault on the hospital and the risk for exposure to both staff and patients. And so we're not going to change that. The skilled nursing facilities, and ours is the Eckerd Living Center in Highlands, and then we also have some other inpatient rehab facilities and hospice facilities. They are allowing visitation in an outdoor setting, not indoors, for 2 people at a time, as long as you can be masked the whole time and 6 feet apart. And again, that's just a compromise. It's not perfect, but I think we are in challenging times. We've never seen anything like this, and I think as I have said just before, a stepwise progression is the best way to go.
Thank you all for joining us. I hope you have found this information helpful, and we'll continue to be here for you as we all navigate this pandemic together.